So good morning, everyone. I would like to call to order the Durham Recovery and Renewal Task Force meeting. It seems like it's been a long time since I saw all of you because we didn't meet last week. Hopefully you guys had a great time taking some time off. I actually realized last night that we actually hit a very important milestone last Friday, which in hindsight is probably the real reason we took last Friday off, but we didn't even know that we had hit the milestone. So last Friday, July 3rd, marked our 50th day working together as a task force. So I think that's worth celebrating. We're halfway through the journey that has been originally defined for us. And I was excited about that, not just because we've gotten through 50 days, but I was really excited about that because I continue to be amazed at the work that we've done in less than 2 months. And I know that no one on this task force is 100% dedicated to just the task force. So I am truly thankful to be working with such a great team that's not afraid to roll up your sleeves and get work done. So happy 50-day anniversary to everyone. And with that, I will turn it over to Mayor Schul and Chair Jacobs to provide some updates.
Good morning, Wendy. Would you like to start and maybe describe the changes in the order and other things that you want to forward, and then I'll follow?
Sure, it sounds great. Well, good morning, everyone. It's good to see everybody again. And as Maticia said, I hope everyone did get some rest last weekend, because we all do need to re-energize and refresh and recharge. And it is hard to believe that this much time has passed. And when I look back at the preparing for today and looking back at the agenda and the notes from the roundtables, and also this week, I really dedicated myself to trying to attend as many of the roundtables as I could, and I saw a lot of Ryan this week. Thank you, Ryan, for your incredible work supporting the roundtables. What I really felt, and when you look at the reports from all the roundtables, is you can see now kind of the level of depth that we're getting into with trying to really bear down and understand the challenges. That's one of the themes that I felt in the conversations that I've been in. And when I think about the challenges we have as things are reopening, with summer camps, having some of the staff become sick, or restaurants having staff become sick, and having to have your staff out quarantining who may have been exposed, and then how businesses are dealing with that. Listening yesterday, some of us were in a conversation with the schools, which we'll discuss more today. But really understanding how important the work of this roundtable is, because everything that is happening in the community, as Dr. Akinboyo says, it impacts every facet of what we're doing. And I do really feel like we're making really good progress. Even the communication and the relations that are building when I sit in the roundtables and hear how people are supporting each other and exchanging ideas and clarifying what their needs are. I just feel how important this work is. Related to the Safer at Home order revision, our 9th amendment, so another marking of the passage of time. The main things in this order are, number one, aligning our mass gatherings with the governor's order to now be 25 people outdoors and 10 people indoors. Also, we have strengthened the guidelines around employee screenings to increase them to reflect all of the CDC symptoms which have grown, things like losing your sense of taste and smell. So now there's a broader, those have been included. We are requiring signage for businesses, all businesses, that is readable and legible and visible from a distance of 15 feet for requiring customers to wear face coverings. We have reaffirmed that we are maintaining Durham's requirement about face coverings, which is stronger than the state's requirements around face coverings. We are strengthening our guidelines around skilled nursing facilities and long-term care facilities, actually, again, maintaining actually a stronger level, slightly stronger than what is in the governor's order. And we are also, there is something in the order about understanding that governments will be creating guidelines related to CDC and the health department that will accommodate possible future in-person meetings. And lastly, there's several waivers to our current Unified Development Ordinance. One that pertains to waiving certain parts of our building permit process if the facility involves something that's COVID related. And another one is to address the needs of our colleges and universities. Right now, we already know that Duke University is going to have possibly more students on campus without their study abroad programs. They are going to be moving some of their students into hotels and apartments off campus, where they will actually take over the operation and maintenance of those facilities. And in those particular cases where a university or a college is going to maintain management, follow CDC guidelines, and have a COVID plan in place, we are also waiving aspects of our UDO that relates to requirements around unrelated people living together. So I think I covered most of those amendments. And I just want to add a quick few things to update everyone on the county side, things that are happening around our homeless shelter. We have moved everybody out of the Marriott at RTP. We have ended that contract, and now we have moved, it's about 50 people back into Urban Ministries, which is about half of our capacity, so that we can maintain social distancing. We have the city and county staff have worked so hard on this, and with community members to find solutions. But they're moving. We have a solution where some folks are now being moved into another hotel. And also we have a great model pilot that is happening where we are working with a local landlord who is willing to rent out some of their duplexes that will also specifically serve for people who may be COVID positive. And also with the second hotel that we have obtained, a smaller hotel, again, is going to be for medically fragile people who are maybe leaving the hospital or they need to recover or isolate. So this is a really big step for us to do this. We've had some positive cases in the shelter, Urban Ministries, which you may have heard about. Those are being, contained and isolated. Feeding efforts. We continue to get volunteers from our community through the Triangle Nonprofit and Leadership Center. Our masks distribution, the county had received 100,000 masks from FEMA, and we have already distributed about 20,000 masks to nonprofits in the community. We still have about 80,000 left, which is great, but we want to get the word out to nonprofits about this incredible resource. And there's a way, it's on the county website, and to be able to apply for those free masks. And also want to mention that, which you may have seen in the news, that our staff is working very closely with the Department of Public Safety around a pilot hotel that will be for people who have finished their prison terms in the state prisons and need to quarantine for 14 days, or are in the middle of their quarantine on their way back home to their families. And so they are, our staff, Rod, as part of that effort, is working very closely with DPS on that plan, which will be starting later on this month. And lastly, I just want to say, and I may have mentioned this before, but our board is funding a really exciting project called the Bulls Initiative, where we're trying to focus on getting funding, an EDA grant, to help retrain people who may be out of work from this pandemic, and be able to get them into the great biopharma and life sciences jobs that we have in RTP and Trayburn and other parts of our community. So with that, I will turn it over to the mayor for additional other really positive news that we will talk about today, other things that are rolling out this week. Thank you.
Thank you very much, Wendy. And great summary of I think some really important things. I have a couple of things I want to mention. We're going to hear from our chairs a little bit later about a couple of our two new websites that are very exciting. So I'm not going to steal their thunder, but I want to just give you a hint so that you'll be interested in what they have to say later, because we have some really great things rolling out. There are a couple of things that I want to just put forward that are happening that Wendy hasn't mentioned yet. One of them is right now, and I believe by Monday, all this money should be out. The Carolina Small Business Development Fund has vetted 132 applications for the grant program. 78 of those have been approved. And so the first $585,000 in grants to small businesses is going to be distributed by early next week. Some of the money's already out. The average grant size is around $7,500. And as you all remember, these are for the smaller businesses, and the maximum grant is $10,000. And there's a lot of good news associated with that. 78 businesses, and of those 78 businesses, 44 of the 78 are minority owned, and 48 are women owned, and 37 of the businesses, almost half, are low income owners, and 3 are veteran owned. So this is really good, a great start, and I want to thank our friends at Duke who have funded this grant program, and also the City of Durham, which has funded the administration of it, and the Carolina Small Business Development Fund, which has done an excellent job. This means there's $415,000 still left in this fund. The 54 applications that were denied for various reasons. Some of them, for example, 6 of the businesses weren't in Durham that applied. But there were a lot of the people who were denied who the staff of the Carolina Small Business Development Fund feels like if they go back and work with them, some could become eligible. And so the next step is to be working with those groups and to increase the number that are able to access the funds. And then with the remaining funds, there will be a second application period. It hasn't been decided exactly when this will happen yet, and there will be additional outreach that goes along with that. So that's great. The second, the loan fund, which is funded by the city and county, has gone slower, as you might expect. And I believe now there are, I think there, I may have these numbers not quite right, but I believe there were 22 applications in. Several have been denied, a couple have been approved, and I think around 10 are still in the vetting process. The expectation of our staff is that the loan fund is going to be available for a longer time into the fall. And we had good conversations about this with some of our staff yesterday, and also with Kevin Dick from the Carolina Small Business Development Fund. And so we can expect that this program will continue, and the loans are available up to $35,000. So I just wanted to give you a quick update on that. And that's, again, I think that's really good news, and I'm glad that we're rolling the money out. I wanted to give a word of support to our Durham Public Schools. Several of us met with Superintendent Mubanga and Dr. Julius Monk yesterday and heard their detailed plans. Dr. Akinboyo was on the call, and I thought that what she said was very significant, which was this should not be an issue for contention or criticism. There is no perfect plan for the rollout of people going back to school. And I thought that her point was very important. There is no perfect plan. We are going to, our school system has done a very, very thoughtful job. I'm really impressed. And Rod was on the call, and our chairs were on the call as well. And I think that we heard a very, very impressive body of work by our school superintendent and the system to get us ready. It is going to be bumpy. There is no good way for this to happen that everything's just perfect. This is going to be an imperfect school year, and I think we all have to live with that. But I want the school system to know that they have my support for this plan, and any way that we can be helpful, we want to be helpful. And then finally, I just want to mention our budget priorities. Not that I have the ones that I want to mention at this moment, but the importance of this going forward. We're going to talk some today about this, but we really need the task force to help us figure out what are our budget priorities that we want to take to the city and the county, to our city council and our county commission to get funded. And we're going to need you all to help us with priorities, and we're going to need you all to help us with thinking through the big picture. So I'm looking forward to that work and very appreciative of everything that the task force is doing. Finally, I want to give one shout out. Our minutes have been taken every week that we meet by our city clerk's office, and I see City Clerk Diana Schreiber is on today. Different members of our clerk staff have been on each time doing the minutes, sharing the burden, and I just want to express my gratitude for them for this behind the scenes work, which is so valuable to us. So thank you to our chairs. I appreciate the opportunity to report.
Thank you very much, Mayor Schewel and Chair Jacobs, for your updates. I will move us along to a couple of other items that we have on our agenda. And the first being the meeting with the Durham Public Schools. So I think Mayor Schewel and Chair Jacobs covered that, but I would just want to reiterate, it was very encouraging to hear from the Durham Public School representatives the well thought out plan that they had put together. And when you have a conversation with someone and they're able to talk about their plan A, their plan B, and their plan C, that tells you that they've spent a great deal of time planning. As a task force, I think we can support their efforts by making sure that people understand their plan. And I won't sit here and try and share the plan with you guys, but Mayor Schewel made a very good point on yesterday, and we're actually going to have them come in to a task force meeting as we get closer to the opening of the schools, so the task force can understand their plan holistically, and so that we can support the plan, because as Mayor Schewel mentioned, there's no perfect plan. Everyone's not going to like this plan, but I think when people understand what they're trying to do with this plan, whether you like it or not, you'll be able to support the plan. So overall, we had a great discussion. There's a lot of interaction, questions from them, questions from us. So hopefully the task force can rally behind what the Durham Public School System is trying to do to keep the students, the staff, and our community safe.
So I will also give an update from the vulnerable populations team from this week. Our team met again on Tuesday and continues to make really good progress. Again, Chair Jacobs did a great job of giving an overview of the work around our homeless population and those community members and how we're working to rally around them and be able to support through this time. So I won't spend a lot of time there, but we did certainly discuss that at length at our meeting this week. And then also focused in on testing and the continued work around testing. I will tell you that testing by appointment is starting at Holton tomorrow, 9 to 12 on Saturdays, and then Tuesdays and Thursdays from 4:30 to 8:30 p.m. These appointments are being made through the health department. So the health department, as they are doing their contact tracing, is then scheduling people who have had a known exposure for testing in this. And these are some of the testing sites for that testing. So we're excited to get started with that. At the same time, Lincoln has really expanded its testing and is now at, I believe, 200 tests a day. Is that right, Phil? And with the ability to over time ramp up to about 300 tests per day. So a lot of good, really good continued work in that area. And then we talked quite a bit about the continued outreach to our Latinx community. And then very exciting news, our face covering distribution. In the first 2 days of the distribution of the face coverings from that the county has, we distributed 20,000 of those. You'll recall we have over 100,000 of them, but 20,000 in 2 days out to nonprofits to be further distributed. So again, really good progress there. Maticia, did you want to do back on the bull or did you want me to go into back on the bull?
Sure, go ahead.
All right. So again, really exciting, and thanks to Ryan and Marielle and McKinney, we have done a soft launch of our Back on the Bull campaign this week. We will do a more formal launch next week, but this website is up. It is up and running. I would ask that—
What you want to say?
Excuse me, Siri is talking to me. I would ask that all of us encourage those that we know who are business owners to please participate in this. It is a great tool. It's a great resource. And that voluntary certification process, we think will be really valuable. A lot of really good resources and just a tremendous amount of work that's gone into this. So we're excited about that launch this week.
And the website looks absolutely great. As I think about the times that we're in, and you go to the website, and I can't say it feels good to be in a pandemic, but as you look at the website, it's like, wow, this is kind of cool. So it brings some light to some of this darkness that we've been living in for a while. Also, another website that we just, I say we, using that term very loosely, but the Durham Has You Covered website just got launched. And I would encourage you guys to go take a look at that website. That website features various minority-owned and women vendors that are selling face coverings. And so even if you don't need face coverings, I think if you go onto this website and just look at the options that we currently have out there, it's great to see that we have that type of support in our Durham community. So please take the time to take a look if you have it, and please make sure that you're encouraging folks to go to the website if they're in need of face coverings.
And then Ryan just did mention in the chat that this will be in Spanish by the end of the day as well. The website will be in Spanish by the end of the day.
Excellent. All right. Since we have been operating for about 50 days, I don't have to call Rod by Rod. I can say, now I'm going to turn it over to the metrics man.
Thank you so much, and good morning to everyone. Happy over the 50th day celebration to everyone. And I too thank you for your hard work and your dedication, and by extension being public health champions and helping us along the journey. I'll start off with just an US overview. We hit that dreaded mark of being over 3 million in cases of COVID. Clearly a mark that we didn't want to hit. However, we continue to move forward. Well over 132,000 deaths in US. Within the great state of North Carolina, we're over 79,000, very close to 80,000 cases of COVID, resulting in relatively low 1,461 deaths. In Durham County, we currently have 465 active cases, 3,826 inactive cases, meaning our Durhamites have been discharged and recovered from COVID. We sit at 67 deaths, slightly up from the last time we met, and bringing us to a grand total of 4,359 total cases of COVID. Happy to report that we have committed to about 8,548 contacts have been made through Durham County and CCNC. Our contact tracing efforts continue to be strong and robust. I'll go a little bit into that a little bit later on. If there's a headline, I know Susan always holds me to the headlines. I would say it's Durham holds steady, positive rates in Latinx communities decrease, and behaviors matter. I think that's worth repeating. Durham holds steady, positive rates in Latinx communities decrease, behaviors matter. As far as a weekly reflection for you all in your consideration, we continue to do well. For the week that we did not meet, our 7-day average did truly dip down to about 59. Last week and the previous week was 67. So we're certainly seeing some improvement. However, the 7-day moving average for last week was 72. So again, we still have work to do. We're holding steady. We're working strong. Again, on Monday, July the 6th, there was 4,173 cases, and that represent approximately 907 cases increased from last week. And of course, that means that's the total number of cases. As myself and Dr. Akinboyo always say, that's just definitely going to increase by virtue of the numbers just continuing to go up. But again, we look forward to the day where the 7-day moving average continues to go down. So far in the month of July, there are 430 cases, new cases. So while North Carolina's trajectory of lab confirmed cases continues to increase, so does Durham's trajectory of lab confirmed cases. However, we are seeing improvements. I always want to speak on race and ethnicity. So far in July, half of our cases, and I stress half, are among the Hispanic and Latinx individuals. They represent at present 50%. As you can recall, the last time we met, it was as close as 80 to 77%. So we're making improvements, and big shout out to Pilar and her group, as well as Lincoln and the Vulnerable Populations Task Force. We're doing a great job. We're making a difference. It may not seem like it, but we're doing very well. But we still have a long way to go, because our Latinx Durhamites only represent 14% of our total population. As far as Black and African American, they're sitting at 26.8% of all cases, while representing 37% of Durham County residents. We are keeping a close eye, and I'll go a little bit into detail in that a little bit later on. Our white individuals, the Durhamites, continue to be very underrepresented, with 22.5% of all of our cases being in this population, while they represent 54% of our overall population. As far as work, race, ethnicity, and sex, again, so far in July, we have a new employer that's kind of come to the forefront per our data. We still see strong numbers for those who are unemployed, but those people who are working in hospitals are being seen in our data, and contact tracers are tending to contact those individuals who are hospital workers. And then we continue to see people working in construction as well. 65.5% of our cases are associated with unemployment. Again, they were Hispanic or Latinx, and 74.5% of them were female. 46.7% of our cases are associated with hospitals, and they were the Black or African American community in Durham, representing 56.7% of females. 79.3% of our cases are associated with construction work settings, and they were of the Hispanic or Latinx community, and 96.5% are males. So our work continues around the construction and all of these different trades. As far as the zip codes and mapping within Durham proper, the zip code 27704 in the eastern part of the county still has the highest case rate at 20.88 per 1,000 individuals. And just be reminded, 27704 covers the eastern stretches of Hamlin Road, Gear Street, Cheek Road, and also includes parts of Bragtown, Colonial Village, and Merrick Moore neighborhoods. So we're seeing improvements in the zip code of 27703. I think for the past month or so, I've grouped both of those zip codes inside our watch list, if you will, but that's showing signs of improvement, and we're certainly delighted about that. Some additional notes for you all in your consideration. Per Duke University's model, which we receive approximately every 2 weeks, North Carolina's growth continues at 1.9%, and Durham's growth is the same at 1.9%. Over the past week, North Carolina infections have grown 16%, whereas Durham's infections have grown 5 percentage points less at 11%. Their model also includes a 7-day average, and they made sure to note that they're seeing a slightly downward trend from a high of 78 last month. So again, it's great to continue to collaborate with them. As mentioned, one of our key metrics is our positivity rate, and I also like to highlight the small victory that we received. A temporary order has gone into effect mandating that all labs, I stress all labs, are to report both positive and negative test results throughout the state of North Carolina. That's a huge win. Again, I cannot thank Mayor Schul and Chair Jacobs enough for advocating for this. I truly believe that their input toward the Secretary of Health and Human Services, Dr. Mandy Cohen, and the governor himself, Roy Cooper, were instrumental in making that happen. So myself and 84 other health directors, we thank you. The statewide order for COVID testing also went out from the state health director, Dr. Betsy Tilson, and that should garner more activity. So that means that there's going to be a whole lot more diagnostic COVID testing going on, and they don't need a physician's order. I mean, this is something that's just huge. So again, Durham should also hear directly from a vendor to set up free testing in areas with high positivity rates and historically marginalized populations. I'm still waiting to hear that because Durham was listed as one of what the state calls Op9 or Operation 9 counties. So that means that we don't have to wait on the state. The vendor is going to contact us directly. And I most certainly have those targeted areas through conversations with Reverend Davis and a number of different individuals from the Latin 19 coalition. I'm just waiting to hear back from them. And once I hear from that vendor, I will be in touch with these advocates to to make sure that we can begin the mass community testing. As Katie so eloquently said, Holton testing site comes online this Saturday. We're so delighted to partner with Duke in managing and ensuring that we are able to get individuals in that particular section of East Durham tested on Saturdays, Tuesdays, and Thursdays. So we look forward to continuing our positive trend of activity with there. We are finalizing some additional contracts, ladies and gentlemen, with a lab testing vendor that specializes in community testing. And our aim is definitely to increase community testing in partnership with, as I aforementioned, the faith-based community, Latin 19 advocates, and continue to target the zip codes of 27703, 27704, and the state also asks us to target zip code 27701. I cannot emphasize enough that behavior modification during COVID is needed. I did participate in the roundtable with Superintendent Mabenga and Dr. Julius Bonk, who I've also maintained a great relationship and communication with throughout the whole COVID experience. And for the most part, they have a great plan in place. And I certainly expect our school health nurses to step up to the challenge and make sure that our babies and students and teens and preteens are safe. But it's worth repeating, and I hope you all will bear with me for just a few seconds. COVID-19 continues to be a disease in which there is no cure. There's no vaccine. There's no prevention or meaningful medical remedy at this time. Once you get it, the only thing that can remedy or relief are supportive therapies. The number one weapon we have to fight this disease is classic, good old-fashioned public health measures. You all should notice, and I'm saying you all to the Durham community and those under the sound of my voice, and remind everyone that you know about this. I think sometimes we get COVID fatigue, and every so often it's worth reminding about the true facts of COVID. There is no vaccine at this time. As mentioned about schools, those of us around the roundtable who are parents, we're certainly concerned. And the last point I will make is that the choices that you make right now on July 10th will affect the ability of our students to safely return to their classrooms approximately around August 17th. We can't flip the switch on August 15th. We have to practice these behaviors right now. So we're talking utilizing face coverings, washing your hands, practicing the 3 W's, social distancing yourself. It's important because, again, these things are going to be drilled down to our students. So you might as well hear it from me, because I can promise you, you're going to hear it from your babies. With that being said, I'll turn it back over to our chairs.
And if I can add, first of all, thank you, Rod. You always do such a phenomenal job with sharing the metrics and giving us such a thorough update. Mayor Schul did ask me to provide a brief update in addition as part of the metrics on our hospitalizations, and I'm happy to do that. So today, currently we are at 90% occupancy between Duke University Hospital and Duke Regional Hospital. We have a total between the two hospitals of 1,223 patients in our hospitals as inpatients. We currently have 63 COVID positive patients that we are caring for, 23 of those in our ICUs. I'm happy to answer any questions about that.
Katie,
can I ask one? So how would you characterize the sort of qualitatively the situation in our hospitals? You know, we hear from Houston and other places that so many of the hospitals are being overrun with cases, and other places where there's fear of that. What would you say is the situation that we're in? You know, 90% occupancy, 63 positive cases, 23 ICU cases. Is that threatening to us? You know, how would you describe our situation?
Yeah, I think, we are managing at this point. We are concerned about the increases that we have seen. Certainly in cases in the community and then in hospitalizations. We have seen increases in the last few weeks in those hospitalizations. And so across all 3 hospitals this week, we were at 90 or above. And that includes Duke Raleigh Hospital in Wake County, which I didn't include in this count and calculation since we're specifically discussing Durham. So I would say we are managing. We have plans to be able to manage, but it's not without its challenges. This is, and one of the challenges in caring for COVID patients is that it just simply takes more staff. And so even where we have physical bed space and physical bed capacity, it's making sure that we have the staff that we need to be able to safely take care of our patients. And we are working on that every day. We do have the staff now, but we are working on bringing in and recruiting, very, very aggressively recruiting additional team members to be able to help us, knowing that, again, this is but a point in time, the numbers I'm sharing with you today, but COVID is not going away anytime soon. So unfortunately, and so we're looking and planning out. We can't plan out on this, I think 6 months, but we are certainly looking and projecting out a month, 2 months, and what we think we are going to need in terms of that staffing and that bed capacity. So we have levers that we can adjust. And if we need to make those adjustments to be able to accommodate this volume. So I would say we are not at the position that we're hearing out of our colleagues in Houston, for example, and certainly not at the position that we heard from our colleagues in New York City, where the situation was so dire. We are by no means at that point. And I feel very fortunate that we're not, but we want to make sure that we don't get to that point, right? Because that means we're really in a crisis point for our community. So everything that we can do to reinforce the basics of infection prevention, as Rod said, wear those face coverings, wash those hands, maintain social distancing, safer at home, disinfecting of high touch areas or surfaces. Those are all the basics that every one of us has the ability to impact today. And we need to all be paying attention to that and reinforcing that with everyone we know.
Katie, if I could, I'm sorry, Madam Chair, I just wanted to make sure I added one more thing. I know every so often there's, we definitely touched on testing, but every so often there's some concern or questions about contact tracing. And I just want to remind the group and Durham propers that we started off with our project with CCNC and their contact tracers toward June the 6th. Prior to that, we had approximately 20 in-house contact tracers who have since been converted to what we consider to be contact investigators. Since that time, we've worked tirelessly with CCNC, and I'm proud to report that we have approximately 55 contact tracers through CCNC. And it's just really keeping our focus on contact tracing, making sure that we hone the tool that they have. But I think bigger news I'd like to report is that we are exploring a partnership with Maticia's very own Blue Cross Blue Shield. And they have expressed an attitude towards service, and they are concerned, and they have a small army of nurses and professionals who think it not robbery to commit to community service in Durham County. So we met with them yesterday afternoon, and we still have some homework assignments, but it looks very promising. And the same way that we were able to bring on Duke PA students to help us with contact tracing, we're hoping to do the very same thing with them. So I just wanted to provide that update as well.
That's fabulous. Thank you. Thanks to you, and thanks to Maticia as well. Wow, that's terrific.
Katie, that's great news, Rod, and thank you. You are just pushing all the time. Really appreciate all of your efforts every day. Katie, I just it's really great to get this hospital capacity report from you, and I'm wondering if we could have this be part of our weekly roundtable update, and also if this could be possibly incorporated into the data hub for public health. This is actually one of the questions that I heard at the restaurant roundtable. This is one of the data points that I heard that people would really like to be able to see. Do you think that's possible, Rod?
Yeah, I do think that's probably possible. We can certainly take a look at how we would do that. Absolutely. Certainly, I can give an update here every week. The one caution I would provide on this is that, our hospitals ran full before COVID. So again, if you look at that sort of proportion of number of COVID positive patients to the overall number of patients that we have in the hospital, so 63 of our 1,223 patients, our hospitals run full anyway. And that is the challenge that we run up against when we're talking about hospital capacity, right? Is that, and it's not like the other, 1,150 patients are not sick patients who need hospital care. They are very sick patients who need hospital care. So that's that balance we come up against. But certainly I can provide that update weekly, and I'll be happy to work with Rod and see how we might incorporate that into the data hub. And I can give an update on that.
Right. And maybe with Dr. Akinboyo, just thinking about what would be the key data points related to hospitalization. So maybe is it just, number of people who are COVID positive who are in the hospital, how many of those are in the ICU, what is the ventilator capacity? I think people just wanting to know, again, thinking about what's happening in other places, and also our PPE capacity, right, for our hospitals. That at certain points, that has been a really critical issue. It does concern me that one of the trends that Rod mentioned is that we're seeing an increase in healthcare workers being COVID positive. So, understanding what is that part of increased hospitalizations or whatever, I don't know. And I think the point that Rod has made and Dr. Akinboyo, and that I think one of the themes is that, everybody's behavior everywhere counts. So people may be very careful when they're working at their jobs at a camp or as in a school or in a restaurant, but what are people doing when they're at home or with their family members or even their friends? It's more, we've seen that with the Latinx community when people are having lunch or driving to work. Sometimes it's the more informal situations where we have to reinforce people's behavior. But, the outcome is, as Rod says, some of these concerning trends. So anyway, thank you.
Yeah, and I'm happy to share that, certainly we are working very hard to reinforce the importance of, we require a face covering at work. So unless you're in an office behind closed doors, as I am right now, the moment someone either knocks on my door or I walk out that door, I have a face covering. I have a hospital issued face mask on. And that is a requirement to even enter the hospital for a visitor or for an employee. But we are really reinforcing the importance of that outside of the hospital as well, because we all need reminders on that.
Perhaps I can make just one comment. Happy to help with understanding some of the hospitalization numbers, but I don't necessarily think it's a reflection of lack of PPE at this point. I think if community prevalence goes up, we as a community work in the hospitals, and so we will see more infections amongst healthcare workers because we all live in community together. So it's what we do within the community when you're with family, friends, preferably kind of staying within the close setting, staying in your households. I think if that's what we're seeing with the shift in the higher numbers of infections in healthcare workers. We cannot say that the risk of acquiring COVID-19 in the hospital is zero, but we have a lot of PPE to ensure that we're preventing that, and we'll continue to monitor that situation and can report on it if it becomes urgent.
Thank you for adding that. Yes, we do not have any shortage of PPE at all. And we've been really diligent. Our supply chain team has worked with us, just done heroic work to make sure that we have what we need and that our team members have what they need at the bedside to be able to provide safe care.
Katie, so listening to you, I was struck by the idea that we've sort of been trained to look at hospital capacity, beds, period. But you were talking about staff, and the recruitment challenges. Is there anything we can do to help with that in terms of the attractiveness of Durham and that kind of thing? Or, I mean,
I think Durham is very,
you have that covered.
I think Durham is very attractive, and we have been very successful in our recruitment. We are always in recruitment mode. That is part of hospitals. There is, there's a nursing shortage nationally. We actually do very well here. And I think a part of that is a reflection of Durham and the Triangle being such a wonderful place to live. So I would say the one thing that, anyone here who knows nurses who may have an interest or not currently working within our health system and has an interest, certainly I am more than happy to have them referred directly to me, and I'll pass that information along to our HR team. But it's just something that we have to keep our eye on all the time and stay ahead of. But thank you for asking that.
Katie, this is Lois. My question regarding the hospitalizations, all of these local people, are any patients being sent here from other surrounding areas?
These are not all local. So that's a really good point. And that's one of the reasons that Duke University Hospital in particular is always at capacity, because Duke University Hospital is a major academic medical center and referral center. And frankly, Duke Regional, we get referrals from all over the state and beyond because of our capabilities. So, and the fact that, that we're part of the Duke Health system. So no, these are not all necessarily local.
Yeah,
which is
sorry.
part of, go ahead.
No, sorry, I didn't want to interrupt there, but to add to that point, and that's why we probably have to be cautious about how we use the hospitalization numbers, because ultimately Duke is mostly full. And I think most of our colleagues and our co-hospitals around this region will function at a capacity that's mostly full and patients shuttle around. So it may not always be reflective of the Durham community, but it may speak to how much capacity we have if there's a sudden surge.
Are there other questions on that? Other questions for Rod before we move into the discussion of the budget that Maticia is going to lead us through? All right, Maticia.
All right, hearing none. So Marysville talked a little bit about the importance of us pulling together a budget and really prioritizing what we need funds for. So we really need to very quickly figure out that process. And as I think we've realized throughout our duration together, we're figuring these things out together. So we don't have a defined process yet. But as we think about a budget process, I think it's very important for us to align with one of our guiding principles, and that being, we need to move this forward with a sense of urgency to compile these budget requests and go through a process to prioritize these budget requests. We also need to be mindful as we pull together budget requests that we have the ability to tap into other resources. So other resources to help us continue to donate their time, other resources that may be able to donate funds to us. We don't want to forget about those resources as we think about pulling together a budget process. As we think about pulling together a request, there's two more of our guiding principles that I think we need to stay aligned with. And that's making sure that when we are putting forward a request, that we're applying a racially equity lens, and we are trying to come up with a framework to address the widening disparities that's caused by COVID-19. We also need to be mindful that when we're putting forth something that we're requesting funds for, that it's being guided by, our public health experts, and we are being responsive to the needs of the people and the businesses that are directly impacted. So those are two things that I think we need to keep in mind. And we also need to keep in mind as we think about budget requests, think about our role as a task force. Our role, our primary purpose is to advise Mayor Schul and Chair Jacobs as they make key decisions are being made on how we proceed with recovery and renewal in Durham. So any request that comes forward should very much align with our purpose and demonstrate that we are trying to do just that. Make sure that we are opening or continuing to expand things that we've opened in a safe manner. So what I want to do at this point is actually have Susan walk us through a budget request that's been put together by the communications team, a great budget request that I might add. And then after that, we can spend some time talking about, as a task force, are there other items that are top of mind that you already think that we possibly may need some funding for? So Susan, I'll turn it over to you.
Yes, I'd be happy to. And what I'd like to do is share my screen, if that's all right, and take you through a very brief, very brief presentation that I think lays this out. Can you all see that? Yes? Okay. All right. So here are a few principles for you all to know about what we've done and sort of lay out where we are from a communication standpoint. Looking at this, first of all, we've been able to, as Maticia was talking about, looking at what other resources are available. We have pulled everything that we can together from a volunteer or contribution basis. So all of the creative production, which is largely thanks to the Center for Advanced Hindsight in McKinney, and a graphic designer on the city's team, the media planning and buying, all the direct communications like email that's going out to all the roundtables and will go out to all the business sectors. All of those things are provided pro bono by the various organizations involved. Where we get stuck is if we don't pay for media placement, all of this work doesn't really go very far. We looked at what the reach would be of all of our collective social media channels that we could potentially tap for this, and we can get maybe as far as 50,000 people. And that's not something we could sustain on a weekly basis. So if we're committed to getting this out into all these communities, there has to be some paid media behind it. And we recognize that no one wants to spend money on paid media right now. So what we did was we put together a plan, and we recognize this might be the Cadillac, and what we can afford to do is something less than that. That's fine. It's just a matter of we need to look at this in the eye and figure out what we want to do. So our recommended plan is about establishing widespread awareness and really pointing businesses and residents to the new website, the Back on the Bull website, where they can get the education and information. So there's the communication messaging does a few things. It reminds people to wear masks. It creates awareness for the whole effort, but it also really focuses on pointing people to this website. And we've designed a plan so that it can be very flexible. It's broken into 3 different phases, and we recognize that we may completely rewrite this plan at any point if we need to, depending on what's going on in the community. So phase 1, there was a phase 1, and then we made it a phase 1A based on our conversation. I think that was Monday. this is the immediate need. We need to launch this now that we have the website ready to go. We need to be able to launch it into the community. And we know that we really need to focus on reaching the Hispanic community. And Pilar has done a fabulous job of setting up those relationships and providing the insight on where exactly to focus those media buys. We'd also like to be in outdoor, in bus advertising, for example. We would be in social media, and we would do a bit of print. One of the first things we'd like to do is put out a full page indie ad, and that has a wide readership and would start to get some real attention. And then we want to assist businesses with signage. That's something that the city has already been pursuing, printing up 100 posters that can, or excuse me, 1,000 posters that can be put out there. So the cost of doing this is $14,100 altogether. We put this together and presented this to the chairs of this committee and Mayor Schul and Chair Jacobs and a few others to talk about this early this week. Because if we're going to launch this over the next 2 weeks, we have to have a decision on this right away. So we tried to carve out a small piece that would get help us start to build awareness in the market. That one is the most important, and the methodology. I'll spend just a moment on these other phases to give you an idea about the scope of them. Phase 1B, the other piece of it, was really what we would do through July and into August, and this would be expanding awareness. We'd like to use broadcast. If you really want to reach everyone in Durham, you've got to go to broadcast media at some point along the way, TV and radio. We need to, and where we can get great deals on media and get our partners to come on board and provide some great rates, we certainly would do that. Billboard advertising is another way. You'll see a number of things about outdoor advertising because the nature of a lot of the people, the essential workers, are out in the community. Outdoor advertising is a good way to reach them. And we know that public transportation has been a point of concern about the potential for that spreading the virus. And we want to make sure that people on public transportation see things also. We are going to be using video, search engine marketing that will direct traffic to the website. And then we've got a few things that we'd like to do, like coasters that restaurants can use that remind people to wear a mask, for example, or stickers or pens. So we've got a little bit in there for that. So this phase 1B, as you can see, is $80,000. Phase 2 would be September and October. This is just continuing the messaging and expanding things that are working, and we will adjust things that aren't working. We put about 110,000 into that phase, and then November and December. So the totality of this campaign takes us through the end of December. Like I said, we will continually change this up and pivot as needed throughout the campaign. Does anybody have questions you'd like to ask? I'm sorry, one thing I'll say is there was a link in the briefing materials to the full communications plan. I think it's about a 10-page Word document. So if you are interested in a lot of details about the media plans, for example, you can see more details there.
All right, thank you so much, Susan. So again, any questions for Susan on this plan before we move on?
Maticia, let me just comment briefly. You mentioned, I think, when we talked about the comms plan, that the way Susan has gone about doing this budget is set a very high standard. Is very thoughtful and very detailed. And so I think that that's so helpful. And it sets a real good standard for when we think about the rest of our process. And I wanted to say that the city manager is on vacation this week. I'm trying to let him be on vacation without hassling him about all kinds of things. But Susan, I got your email and will be in touch with him today about the request for the 14,000, and we'll have some quick discussions with him at the beginning of next week.
Great.
I wanted to thank you for that, and we can be in touch about it, Susan.
Okay, thank you.
Yeah.
Okay, so again, as we think about the budget process, and I think what Mayor Schul said is spot on. Susan and team has set a very high standard. And I appreciate that, because I think anytime that you're dealing with money, you want to make sure that you have the appropriate information that you need to make a good decision. So as I think about us moving forward and trying to get additional requests, we're going to try and quickly work up just a few key points that we want to be included in every request. And I think I'll go back to just making sure that in the request, it clearly articulates how the request aligns with our guiding principles and our overall purpose. I like how Susan just presented this information and presented, so it's immediate. I think it's important for us to understand in any budget request, what is the immediate need? And I would say, you know, when you lay out the immediate need, be able to articulate, so what bad thing happens if we don't fund this immediate need, so that we just kind of understand what are the implications. Again, I like how Susan and team laid out the timing, because I think the timing is very important, because any budget request won't need to be funded necessarily on day one. It could be spread over a period of time. So I know Ryan has committed to help us trying to get something built out that we can share pretty soon. Now I just want to open it up to the task force to talk about any items that are top of mind for you as you've worked with the various roundtables, as you've worked on the various things that you've been involved in. Are there any items that are top of mind for you that you just want to share?
Maticia, I wanted to make one comment just in general, which is, as we make this budget, I think we really need to coordinate closely with the Emergency Operations Center. So I think, for example, the Emergency Operations Center has what we would call a roundtable, but it's really through them, about food security. And they're going to have some budget needs. And so, you know, Jody's here and is in close touch with all those groups. So, you know, where does a quarantine hotel fall in our budget priorities? Where does, what other food security needs are there that need to be part of this? So I just wanted to mention that as we go forward to that, I think we should include the EOC and their working groups in our budget requests, and kind of make this a holistic kind of thing.
And this is when I just want to jump in on what the mayor said. I think it even is to the point that, and Jody is actually the perfect person. She's really our expert on the CARES Act funding, is that it's also important that the budget requests we try to align them with what we know is reimbursable funding from FEMA, or through the CARES Act, or through other state or federal funding. So it may mean that the way that we even, the kind of language that we use around these budget requests, if we can tailor them to what we know is reimbursable funding, is also going to be important. So I agree with the mayor that the EOC be involved, and especially Jody. And Jody, I don't know if you have any comments about how we look at these funding proposals or budget requests.
Mayor Schul and Chair Jacobs, you were both reading my mind, because it really struck me that as we talk about each of these strategies, we need to be thinking about it in a sort of a holistic, broader community aspect, and making sure we're understanding the financial needs and responsibilities, and how we pay for these things is going to be very important. The other thing I was also thinking about in terms of the media and communication plan is we have a very robust public information strategy through the Emergency Operations Center, and working with public health, and wanting to make sure that there's collaboration and alignment with any communication strategy that we're doing together, so that we're making sure we're targeting the appropriate communities, and that we're sharing resources and information, and so that we're reaching out to those areas of the community that are most in need, but also sort of the larger community as well. So we can work together on this as we continue to better understand what our needs are and what the financial requirements will be.
Thank you for that. Any other thoughts or comments about the process, things that we should take into consideration as we move forward? Things, again, that you've already given some thought to?
Well, I had a question. So this was presented, and this was great, what Susan presented. What happens? She's presented, she said that she would need $74,000 spread over 6 months. Does the task force discuss it? Or, I mean, what's the next step for Susan? Is there a budget? I mean, is there a limit so that, you know, by September we know there's $200,000 and we only have 15,000 left? Or is it kind of a never-ending budget? Which, wow, that'd be awesome. How do we do that? But I'm just curious, because it seems like she's presented, and I'm really not sure what what we're going to get to push this out to the public. And then if someone else comes, what's the steps?
Great question, Nicole, and thank you for asking that question. So in the House, she presented the information, and as Susan mentioned, there was a meeting earlier this week where KDI, Mayor Schul, Chair Jacobs went through the actual plan. What she's included is an item that needs immediate funding. I think that was about $14,000, and I think that's the item that Mayor Schul said he was going to reach out to the city manager to see if we can get funding for that immediate need. But everything else that's in here is going to go through the budget process, because again, we need to prioritize things. And, you know, and I'm thinking out loud, but it's probably not going to be a task force that comes together to go through the budget request, because I think that would be a heavy lift for all of us to try and go through this budget request. But it's probably going to be a small group of people that go through the budget request and hit on all of the items that we just talked about, and then come forward with a prioritized budget to say, task force, this is what we're planning to move forward with, to make sure that we are all aligned with our path forward. Does that make sense?
It does. Is there like a deadline that you have to get things in so that you're on that list?
Yes.
Understanding that we don't know what November might look like compared to today. So things could so drastically change. So is there, you know, must submit things by this date, or?
And that's what we're trying to define, Nicole. We're trying to get some dates. So we're trying to understand when will we need to present the budget to the city or county and work backwards from that date. We haven't gotten clear definition on that. But the way I think about it, Nicole, is our current plan, and we're going to see if we can pull this off, is to possibly send out some information this upcoming week to say, if you have a budget need, let's go ahead and work on getting that turned back over to us, and maybe give about a week to turn that around. So at least we have the information, because it's going to take us a little bit of time, I'm not saying weeks, to get through the information, to distill it down to what we think may be a priority. And so that's why I say we need to move forward with a sense of urgency. I wish I could say by this date, I need this from everyone, but I don't want to put false dates out there until I get better clarity around when do we have to present the budget that we need to a body for their approval or disapproval.
Okay. And the thought is that it would go to both the city and the county, or one or the other?
That's right.
And a formal presentation in order to move these initiatives coming out of the task force. This is what we're requesting, and then the city and the county elected bodies would decide.
That is correct. That is correct.
Thanks.
And again, because
maybe I missed that a couple of
No.
meetings ago. I missed it, but thank you for clarifying.
No, and again, because we don't have those specific dates yet, our ultimate goal is, and I think I've heard this from Mayor Schul, he mentioned it at our last meeting, which was 2 weeks ago, that we need to really get moving on this with a sense of urgency. So if we can position ourselves to do the work and have something ready, I just want to make sure that we're ready to push this forward, regardless of the date that we find out. So we're not going to sit and wait and figure out, okay, we won't be able to take this forward until some date in the future. I want us just to be prepared to go ahead and keep this moving.
Yeah.
And again, if there are immediate needs that we have, there may be a way that the task force can rally and try and figure out, are there other options to get funding for some of our immediate needs.
Okay. Thanks. Appreciate that.
You're welcome. Other questions or thoughts? All right, so hearing none, and again, we will continue to work on this and communicate, iterate, and share with you, how this is shaping up, and share with you what we need from you to help support the process. All right, then I will turn it to Katie to do the roundtable update.
Great, thank you so much. All right, so I think you have the roundtable updates in your packet, and I hope everyone's had a chance to review those. I'm going to ask Brian if there are any specific highlights from this week's roundtables. Unfortunately, I was not able to participate in any of the roundtables this week, but I know many others here did. So would love to hear any specific requests coming forward to the task force that we need to be considering at this point.
Morning, everyone. I'm sorry my audio is kind of going in and out, but thanks for all the good work you're doing. I think we've had some continued great conversations in the roundtables, and the ability to drill down on specific issues to different industries. I think the one big theme I would just want to go ahead and throw out there, and then certainly am available to answer questions, is I don't know how the state's numbers are going to continue to look as the potential to move towards additional phases at the state level. But for those industries who are in a phasing situation like fitness centers, I think they're interested in some indication of whether Durham might expect to be in sync with the rest of the state whenever that announcement comes, or if we may continue to operate on somewhat of a delay. So I just kind of ask to lift up that question, and then certainly available to answer additional questions.
Thank you for that question. I think that's an important question. I'm hearing the question around particularly those businesses that feel like they're in limbo at this point, right? Because they're waiting for phase 3 and not sure when phase 3 may come, and if phase 3 will be similar in Durham, or whether we will continue to operate a little bit more cautiously. And then the other question that I think has come up is around guidance for our festivals and large events, and wanting some guidance from this group around, do we define a period of time through which no large gatherings would be permitted? So would love to have some discussion here on, and I'll ask Mayor Schewel not to put him on the spot, but I'm going to put him on the spot a little bit around this in terms of what he's thinking around that phase 3 guidance, knowing that may come in the next week or two. And then maybe we can have some discussion around specifically large events.
Sure. I don't mind being put on the spot about that. I already feel on the spot about that, so no problem. I'm sure Wendy does too. I think what I'll do is, rather than sort of speak to the specifics, I'll speak to the process a little bit. What we do as we anticipate the governor's orders, is we consult with Rod. We consult with our public health folks. We look at, is Durham the same, or are we trending better or worse than the state? Do we have any special conditions in Durham around any of these businesses that might make us want to do something different? That kind of thing. And so I can't say now, for example, what we would do about gyms if the governor decided to open gyms. You know, our first, we place a high value on consistency with the state order, because we know that anytime we're not consistent with the state order, it does cause confusion and compliance issues. So we place a high value on that. But as you know, we haven't always done that. For example, we had the face coverings mandate for a couple of months before the state did. So that's the process. And, we take it very seriously. We don't do anything callously. Our goal is to try to let as many things open as possible, as long as that can be done safely. That's our goal. Our goal is to have as many things that are safe as possible open.
Thank you. Chair Jacobs, anything you wanted to add to that in terms of process?
No, I think that Steve really covered it. We consult with, Duke. We look at, the Duke data and also the county public health data. Everything goes through Rod. I know Dr. Akinboyo is a key expert that we rely on as well. So I think it's just going to depend on our community, to be honest. Just reinforcing, I think, what we've all been, one of the themes today. I honestly, a very big factor for our community is going to be the students from Duke and NCCU coming back into our community. We just saw yesterday that Orange County is going to be closing restaurants and bars at 10 p.m. And the reason they've had to do that is because over the past month, they've seen their cases triple, and they're seeing a trend with, young people. And I think Rod did not get into this today, but I know from his report to the Emergency Operations Center on the multi-agency call on Wednesday that what we're seeing in Durham is that younger and younger people are testing positive. We have our average age now is 39 in Durham County. So it's going to be really key when we have students coming back into our community from all over the country and even all over the world. And they are going to be living in the Durham community off campus. Their behaviors are going to really, impact all of us. And I think and that's why I'm so excited about our Let's Get Back on the Bull campaign. And I think why Susan's request for additional support for communications is so, so important, because we have this great opportunity to really, pull in the whole community, get everybody on board, and help everybody understand that each of our own individual decisions and behaviors, we're not in isolation. Everything that we do impacts somebody else. And so if we want to be able to move into the next phase, and my heart breaks when I sat on the fitness roundtable and to see that who is our fitness and our gyms. They are small businesses. They are owned by minorities. They are owned by women. They want to reopen. And my heart breaks for them. And so, we really need, as our students come back, to understand that when they have parties and gatherings, and how they behave is going to be really what is going to impact, what we're able to do. I think the more we can be successful with that and work together, and again, getting back to what I think the request is around marketing and communication, to really leverage this incredible free work that we're benefiting from McKinney and Duke Center for Advanced Hindsight. If we don't have the ability to really get this out into every part of our community, we're not going to get the full benefit of it. So I guess that's my long-winded response. But thank you.
Thank you for that. And I do know that we are working on scheduling or have scheduled some meetings coming up with Duke University as well as NC Central to understand plans for bringing students back and how we bring them back into the community as well.
Also like to
Katie, can I just add one comment and maybe someone can help calm my fears? Because I think I hopefully heard this right, that I think it was the UNC football team that got infected with COVID-19, the football team. And the same thing has happened, and this was maybe a month ago at Clemson University. The football team, the team got infected with COVID-19. And I think that's very concerning because this is just a football team. And I understand, playing football, you're with your teammates and you're in close quarters probably at all times. But as you think about any college campus, unless they're going to drastically change the way students are able to interact, I do worry about that because we've had those two recent incidences that have happened. And both of those are pretty close to home. So that's very concerning as we think about just going back to a campus.
To the members of the roundtable, if I may, I just wanted to just give a couple of quick points. I have been in touch with a number of health directors throughout the state, from the mountains with App State to Joshua Swift, Forsyth County, with Wake Forest, to Quintana Stewart with UNC. And this is something that we've been talking about probably for the past 2 months in anticipation of this. We have talked with several of the athletic directors and medical professionals for these universities. I personally have reviewed NC Central's overall campus back to school plan, but particularly with their athletics because they come back so early to begin their training. It's very comprehensive, and just like we mentioned with the schools, it's not perfect. It's not. These are contact sports. We talk about anything from how they travel to games, how they work out, how they their living arrangements. And again, with this being so novel, we're just kind of giving our best guess and our best effort. But nevertheless, there's a consortium of health directors that we just kind of rely on each other for best practices and just talking through different things. And there's a certain amount of relief. Now I'll end with this. There's a certain amount of relief when we hear that the Atlantic Coast Conference has decided to hold off until September 1st, or Ivy League schools have decided to just shut it down completely, because they too realize that, you're putting lives in danger. And being a sports fanatic like I am, again, we want sports. We want some type of respite from all that we have going on, but we want our community and our nation at large to be safe. So, Maticia, I feel you. I understand your concerns and your fears, personal as they may with your college student, but I totally get it. And I can speak on behalf of the schools that I've talked to. They care, and they definitely don't want any harm to come to the way of kids. But let's be clear, ladies and gentlemen, the UNC system has said they are not going to shut down. They're going to keep going. And we just have to continue to try to support them as best we can.
Thank
I
you.
wonder if George had any comments from the perspective of team sports. He is our resident expert.
But I don't have a sport to worry about. You know how that's going for me with no baseball. And honestly, I think that's why the minor leagues have gotten the shaft, really, is that the major league clubs didn't want to worry about all of this in 160 different cities and towns across America with 160, different situations. So they just threw in the towel and decided to concentrate on the major league sports. I'd actually be interested in what Rod has seen. My reaction to these football situations was those young men probably brought that to campus with them as they returned. And I would like to think that they're actually about to enter a much more structured environment. I realize there's certainly some dangers, but they're about to enter a structured environment with a lot more protection and a lot more focus on this. And the ending won't be as troublesome as the beginning. But I see both sides of this. I wish we were playing baseball. I wish I was in a position to make a case for something big we had planned at the ballpark. I know the DPAC would like to be back in business. But, to me, the big thing right now is to get the schools going and see what happens from that. I mean, that to me is the next colossal wave, the thing we've got to do, and see what happens before I would become a lobbyist for big public events. I wouldn't feel right about it.
So that's actually, I think, a good segue into this discussion point about big events. And I think that our roundtable, as I understand it, the roundtable on festivals and large events is looking for some guidance and some direction from us. It is really challenging, having done some event planning in my past. It is really challenging as an event planner to be trying to plan an event. I can't imagine in the midst of a pandemic where you don't know whether what's going to happen next week, let alone in 3 months when your event is scheduled. So, and there are so many penalties if you don't cancel by certain dates. And there are so many things that need to be put in place. There are so many details that go into planning any kind of event like that. So they're looking for guidance and direction. And I think would put out to this group, can we provide a date by which, we would recommend to Mayor Schewel and Commissioner Jacobs, there be no festivals prior to this date. So is it that prior to October 1st, there would be no festivals? Is it that prior to, do you go to January 1st? But I don't know how we get our arms around sort of, and I feel a little bit like any decision would be somewhat arbitrary at this point, but I think what I'm hearing is that they're looking for a decision, even if it is somewhat sort of pulling this out of thin air in terms of a date, because they have to be able to plan. I don't know, Susan, if you are so much closer to this than I am.
Yes, well, you laid it out really well, but you're exactly right. And given that Wake County made the announcement a few days ago that they're going to cancel all events and festivals and things through the end of October, it raised the question here. In some ways, it does make it easier, even though no one likes to contemplate that we won't have events even that far out. It does make it somewhat easier for those event planners. The venues are dealing with clients every day who are asking about when we'll be able to have events. So yeah, but what you said is great. And I wish I had a clear-cut answer for how it gets done.
I don't know.
Well, I'll probably get nuked on Twitter for taking this position, but I think I would sort of base this on what happens after school resumes. So, I mean, I would be comfortable with a date like that is the appropriate time after which school has resumed, at which you would be evaluating this. But it's like school's resuming the middle of August, and we need, what do we need, right? I mean, we need 4 weeks or whatever the magic number is. and then we'll decide whether it can be done.
I'd agree with something like that. And also when we come out, what the events need to do. DDI does a tree lighting in downtown Durham. We're looking at, do we do that? But the bigger concern is, how do we ensure, if there is a limit on how many folks can be in a space, how do we ensure that more people don't come because of just the excitement of some kind of normalcy? And that is really the thing that and I think a lot of events, especially outdoor festivals, you want to comply, but word gets out, regardless of how much you may or may not market it, word gets out and folks are like, oh my gosh, that's something I'm used to, I'm gonna come downtown. And you can't really go first come, first serve, and then we're just gonna have barriers up and have you waiting, or is that the option? So I think when we roll out events, we will take a look at events and festivals happening at this time, and here are the safeguards that we'd like to be put in place to ensure you're going to comply. The second thing I would throw out there is, as we're not having these events, the economic impact that is happening, not only to those venues, and of course it's very obvious when you think about the Bulls, DPAC, but schools not having football, the money they're not bringing in, and I'm not advocating, so I don't want to get out there that I'm advocating that we should push, but that is an economic impact that the city will feel in 3-4 years from now, because they are not making that money and it's not generating the things that have that build upon that. So because they're not bringing in whatever the millions of dollars that they bring in, NCCU and Duke, what does that mean 3 years from now? So that's another consideration, and maybe that's something for the task force that I'm on with Ed, Pilar, Susan, and Geoff for us to kind of consider. But I think there needs to be some thought about what is this going to do to our local economy by not having those events.
Good point. So I guess the thought of sort of tying this to let's get students back and the schools back and give some sense of time after that. I mean, Wake County, I think, is end of October, they've said. Is that correct? Okay. So I'm seeing some nodding heads. So, do we want to make a recommendation that we align with Wake County? Or, if schools start back in August, could we say, no, sort of think about it in quarters of the year, no events through the end of September, which would be end of a quarter, and then reevaluate at that point?
So I would always just go back to the data, and I think I like the idea. I almost feel like we planted George to make a comment for Rod and I, but I like the idea to, we expect both university students and elementary K through I think 8 is the most recent plan, to return to a congregate setting sometime within the next month. And I wonder if it's worth giving about 4 weeks from all of those restart of the school settings to see what the data shows, and then ultimately making a decision. And that may line up to probably the end of September, and giving some guidance afterwards based on data. And I hear all of the concerns. I know we can't always say we understand exactly what everyone is struggling with the unknowns, but also with lack of planning, but also with the true financial impact that everyone is experiencing right now. And I think we can give more specific guidance actually for the indoor setting, because there are a lot more ways you can control who's coming in and who's going out. The outdoor setting has so many, just tends to have a lot more nuances and moving pieces that I think ultimately, except if there's a true entry and exit, when it's more of a free-flowing outdoor event, I think people have struggled to understand what social distancing would look like in that setting. So all of that to say is, we need data, and when we have data, it would be easier to make a more informed recommendation, and that might be a little bit easier after about 4 weeks of our local schools being in some kind of structured setting.
Thank you. Rod, anything else from a public health perspective?
I concur with all the sentiments. Again, all of our decisions are data driven, and again, I've been personally pressing State Department of Health and Human Services in terms of guidance around these topics, and I've not received a whole lot of answers. We kind of plant the seeds and then we wait on them to let us know. And maybe it's a situation which, more than one person is saying the same thing, and all of a sudden they kind of gravitate toward that topic, if you will. But I would caution mass gatherings because, again, it's the clusters, it's the inability to social distance, it's the fervent desire for normalcy that really gets everyone in trouble. And as we're seeing rates spike in Florida and Texas and Arizona, we just don't want that. I mean, we really want to get, well, I would say keep things in control. So I would just say, caution. Schools, we're a community that love our kids. We love school. We're an academic community, and that's where a lot of our priorities are. So I think we really need to focus on that, and then we need to make sure that we can assess the data shortly thereafter.
Okay.
Rod, can you talk a little bit about testing, the importance of testing as students come back to the campuses, as well as students re-entering the K through 12 environment? And, we talked about giving it 4 weeks, but it seems like there needs to be a certain amount of testing that needs to go on in order to give us the appropriate measurements after that 4-week period.
I want to make sure that I'm clear with one thing, and the COVID-19 test is a point-in-time test. And testing is certainly not the end-all be-all, while it's very important. Testing is important, Mr. Nelson, because it helps us to locate where the prevalence of COVID is. And, I say this with a whole lot of trepidation, but, again, as the mayor said, it's going to be a bumpy ride because, as the chair said, from the colleges, they're coming from all over the world. They're coming from all over the country. And we simply don't know what they're bringing with them. Some colleges are instituting protocols to where they're going to test every student initially. Some are not. Some have segmented dormitories set up. Some don't. As far as K through 12, again, there's a plan A, B, and C that Dr. Mbenga eloquently laid out. And we're going to do our best to support them in every way possible. But again, testing is it's just one facet. But as I've been saying for months, it just all goes back to old-fashioned public health practice. And once you are able to identify those individuals who may or may not be positive, you still fall back to those public health practices. So I certainly hope I answered your question.
So I think, and this is great dialogue. Thank you all so much. Really appreciate it and appreciate the insight that everyone's sharing. I think what I'm hearing generally is certainly any decision would need to be driven by the data and should be driven by the data. That's what we've set out in terms of our guiding principles for this task force. And that in order to have the data, we need at least 4 weeks probably after the beginning of school. That 4 weeks would put us at mid to late September. So to make it easy, if we said there would be no mass gatherings, no events, festivals or events between now and the end of September, and that at the end of September, we would reevaluate and provide guidance based on the data for events moving forward. And that would be the recommendation of this task force to Mayor Schul and Chair Jacobs. Am I capturing that appropriately? Is there anyone who, I've not heard any any dissent on this, and certainly would want to make sure we're capturing, we want to capture all perspectives here. So if there's someone who has real concerns with that, please share that now.
I think that's a reasonable approach. One thing I would say, and I agree with the idea of using the data, but I doubt that we would just wait until September 30th and let people think that starting October 1st events are okay, because I think we're going to learn more over the next 6 weeks. And we may decide along the way that we want to move that date out. So that would be the only thing I would say that I might add to what you just said, but I think that's a reasonable approach.
Anyone?
Katie, I really like the approach because it's not arbitrary. We have some basis to support the recommendation. So I feel like it's a great recommendation because we can tie it back to this is the why.
Right. Okay. Is there anyone who disagrees with that recommendation? All right, so that will be the recommendation from this task force to Mayor Schewel and Chair Jacobs. And then from there, you all can decide how you then take that and move forward with that.
One thing
we'll include that in an upcoming amended order, I'm sure. Anna Davis is on the line here, our attorney, and I'm sure she's listening as well. So we'll make that work.
One thing we might do is just allow for a period of providing thoughts about particular types of events. What I see in some of these rulings is you make the rule and then you find no one considered one little pocket that actually is a reasonable exception or something like that. I've already gotten a comment here about what about races and marathons? Is that included? Would that be included in this? What's the definition of an outdoor event? So I don't know that there would be anything that we would want to exclude, but I would just say if we can take a couple of days and think about whether there are any specifics that need to be either written in or excluded from the order, I think that would be a good idea.
I wonder if this could go back as the recommendation to that roundtable and then ask if they have considerations around what exceptions, if any, might need to be made.
That
Because
would
they
be
know
great.
events better than we do, or than I do.
Yeah, we could do that. That's a great idea, and we could certainly do that.
Okay. All right. Perfect. Okay, anything else from the roundtables? Good work.
I'm sorry, I do want to just bring something to everyone's attention. It's more, since I have the forum to share, there is a bill going through the US Congress to help independent restaurants. And I'm going to send something out later on this afternoon about that bill. And we're looking to get, I have to do a huge shout out to some of our local restaurants, Copa, Elizabeth Turnbull, and a few others that have really taken the lead on that. But I'll send something out to my email, and if you could share it, we're really trying to gather and garner support for this. It is to creating a fund to give money to some of our independent restaurants, a dedicated fund to independent restaurants across the country. And Price and Butterfield are co-sponsors, I believe. I could have that a little wrong. And they're looking across North Carolina to get all of the US representatives and senators behind this. But I just wanted to keep an eye out for that this afternoon. And if you can please share it. They're just looking for support, folks who are willing to reach out and call their representatives and say, yep, this is a great thing, please do it. But it is at the federal level, and they're looking for a sizable amount of money that could then be given out. It would go through the Department of Treasury, I believe, not the SBA. So it would probably behave a little differently than the PPP and would be open for any number of things to include rent, mortgage payments, to assist some of our independent restaurants. So kind of came out of the roundtable, but really it's just, hey, this is really important. If you have a close connection to your representative or know people who do, please share the email that I'll be sending out to all your friends and networks.
That's terrific. Thank you so much for that update. And that's really good news. Good news for our restaurants. Hopefully we'll get it passed. Other updates that folks have or anything else that you'd like to discuss, if not today, as we're running a little bit short on time, is there anything that you'd like to discuss for next week that you want to make sure we include on the agenda?
Katie, I just wanted to, before our meeting ended, I really want to recognize, Rod and all of his staff and Pilar and everybody who has been working on the outreach to our Latinx community. I really don't want us to, to let it slip by the fact that we have really gone from, 77% of our cases down to 50% in the Latinx community. I mean, we still have a long way to go, but I do think that that speaks volumes to the work that is happening on the ground, from, just the outreach, public education, resources, the contact, the more bilingual, culturally competent contact tracing, the help of the construction industry. I shout out to the Home Builders Association and folks who have put together a great video and guidance to the construction contractors, subcontractors about safe practices for their employees when they're driving to work, when they're at lunch breaks. I think that it just shows that these efforts are paying off. And so I'm just grateful and want to recognize you, Pilar, and Rod, and everybody who's been working so hard on that. Thank you. And Philip, I know you've been a part of those efforts. It really speaks volumes to the teamwork. So thank you.
Yeah, thank you. It's been a heroic effort.
If I could, Katie, also we'd like to update the group on our committee's work as far as an equitable recovery committee that consists of Anthony, Susan, Nicole, Pilar, and Ed Boyd. We've been meeting for the past, I guess, month or so, and have kind of created a framework about a sort of a rebound and recovery in various different metrics. And we'd love to kind of give you guys a summary report next week, and then open up for a broader discussion.
Excellent. We'll add that to the agenda for next week. That's terrific. Anything else? I believe we'd also like to get maybe an update from the immigrant refugee roundtable next week. I know a lot of continued really good work again going on there, and maybe some specific requests that they have for us. So would love to add that to the agenda for next week.
Katie, I have just a couple of quick comments. What a great task force. Gosh, I cannot believe how awesome this has been. I'm so grateful. And Wendy and I have been exchanging chat about this group today. We are so lucky to have you. Thank you so much. And for the people who are supporting the task force, who we see along the bottom of our screen here, Brian and Anna, Ryan, Amber, Marielle, and Drew, with gratitude to all of you all. Just a couple things. The budget process, I just want to add this. I want to say again what Maticia said, which is I really feel a sense of urgency around this. And I think what the task force needs to do is to give us a budget. We need to understand what the big picture is. So the coordination with the EOC, how important is a quarantine hotel and what does it cost? What is our overall PPE need and what is it going to cost us? We don't know exactly, but estimates of these things. What are we needing to continue to do around food security? And then all the things that we have surfaced, sort of big and small. We have this request from restaurants for support for outdoor dining. We have requests from restaurants around airflow mechanics. We have the communications request. And I think that I know what would be valuable for me, and I think would be for our managers and for our city council and commission, is what does the big picture look like? But then also, sooner than that, what are the really top urgent priorities? What are the things we need to be spending money on now that we can try to kind of quickly move? So I think if our chairs and our task force could help us do those things, that would be great. You know, one thing I wanted to mention, I forgot to mention, is that in support of Back on the Bull, we're going to be distributing, printing and distributing 1,000 signs along with face coverings and education to some of our small businesses to help them talk to their customers about masking up and their employees. And so we want to be assisting our businesses to do this, not just, you know, this will be through Back on the Bull as well. And I did forget to mention that. I wanted to. The other thing I've been thinking about is this, and, you know, what is the prevalence in our community? So right now, more than 1 in every 100 people in Durham has contracted COVID-19. If we have 60 cases a day for the next 3 weeks, well, let's see, in the next, if we have 60 cases a day in the next month, that would mean 1 out of every 50 people in Durham would have contracted COVID-19. So this is, you know, for me, I have, maybe many of you all have already known people well who've had COVID-19. I haven't until recently, but I now have 3 good friends who have COVID-19 and are sick, very sick. And so the threat of the virus continues to be very significant at the same time as we want to reopen. And so I'm just so appreciative of everybody trying to stress these public health practices. They're just so crucial. And then the final thing I want to mention again is what I think is the need to help us with compliance. I really continue to think we're going to need more sanitarians. And I feel like Rod and his staff are already so pressed that we have to figure out how to fund some more of these. And I really hope that that will be amongst our budget priorities. People that can go out to businesses and come and help educate them and can work with them on best practices and to figure out how we can get more compliance. So those are some thoughts that I have. But my main thought is just gratitude to you all. What a great group. And you all have been doing such amazing work. It's making a big difference.
Thank you so much. And I'd echo it. Thanks to all of you for just the incredible work. This is an amazing team. It really is just an incredible group. Maticia, anything you wanted to add before we close out?
I don't have anything new. Just a couple of items that we need to focus on moving forward over the next week. I've captured those items and I'll just highlight a couple of those if you don't mind, Katie. So just coming out of this meeting, we talked about Katie presented to us weekly some hospital stats and trying to define what are those critical stats that we want to focus on, as well as trying to figure out, is there a way to get some of the information on the data hub. Budget, a lot of work to do on the budget process, and we will work diligently on that. And I'll take the lead on that, working very closely with Ryan. I think Mayor Schul committed to working with the city manager to get the funding for the phase 1A of the communication plan. And then we had some conversations about the recommendation about like outdoor events. And I think where we landed, Katie, we basically said we're going to ask the round table. I wasn't sure which round table, but a round table to really shape up the recommendation that we can move forward. And then Mayor Schul and Chair Jacobs will work to get that in an amended order in the future. So which round table is going to take the lead on that?
That's the festivals and events.
Yeah,
Okay.
entertainment venues and events, yeah.
Okay, got it. So that was it.
All right, great. Well, if there's nothing else, we have, we're going to give you back 30 seconds in your day, but I don't know about you, but I'll take 30 seconds any day. So thank you all so much. Have a great weekend. Thanks for all the work.
Thanks, everyone.
Thank you, everybody. Bye.